Good evening, this is Dr. Dell again. This video is alphabetic list of problem on letter C. Today I'm going to talk about the colposcopy and cervical cancer prevention. This is a big strategy progress during last 4 decades for women cancer prevention program. Started in 1970s or even earlier. The exfoliated cervical cells serving as the cancer screening. So since then, the Pap smear. So the cervical cancer has tremendously decreased in terms of mortality, in terms of the cancer diagnosis. And later on, the colposcopy was invented, and so this. Accordingly, the HPV, the human papillary virus vaccination. So these 3 strategies together, so significantly decrease the cervical cancer. So let me talk about the female reproductive system briefly. So the cervix has the cervix has the stratified squamous cells, just like our skin, but just the lack of the corneal layers. So these stratified squamous cells exfoliated regularly. So they're using these falling cells to examine under microscope to detect the early cancer stage. So this is the idea, the mechanism of Pap smear. The Pap smear usually start at the 19 years old or 21 years old, depends on the guidelines, depends on what society is talking about, like OBGYN or other specialist or the primary care. And start different age, and all the HPV vaccination, it started early, started teenager to give the virus vaccination. For those already past the age, have never received it, always can catch up by 19 years old to catch up with the vaccination. So this is the prevention of the cervical cancer. And the colposcope is just the scope with the magnified power to look at the cervical cells, to look at the cervical structure, and if there is something abnormal from the Pap smear result. So usually this is not done to everybody. Basically, this is so at young age, teenager, you start HPV vaccine, and then twice of vaccination, and when you reach to the reproductive age, start about 19 or 21 years old, you do the Pap smear every, if it's normal, then you go to the regular routine schedule every 3 years. But if it is normal, if it's the result came back, there's a doubt or suspicious of the abnormal cells, then you need to follow either 6 months later or do the colposcopy. Depends on the cell, the Pap smear results, or depends on your different society has different criteria, and also depends how severely the cells proliferated from the original normal cells. So if it is really high grade proliferation, so then probably just do it colposcopy. If it's low grade, then follow up 6 months, or probably just repeat another Pap smear to determine whether those abnormal cells still there. If that's the case, do the colposcopy. So this is the cervical cancer prevention. What is any emergency situation regarding to this cervical cancer? Actually, it's a slow process. The female reproductive system do have some emergency situation, like bleeding, the vaginal bleeding, huge amount. Is usually from the fibroid, which means the tumor of the uterus, sometimes cause the local inflammation or the tumor. It's a benign, but one cause it because the size or the blood vessel proliferated, so cause the profound bleeding. So if that's the case, really need to see the emergency, and if you see the spot, you need to call your physician. In terms of cervical cancer itself, or I couldn't think of any, unless the cancer invade the big blood vessel, cause the bleeding, you need to see the emergency. So this is the general idea to explain for those, particularly from immigrant or different country, come here, does not know what is the Pap smear, what is the HPV, or what is the colposcope. What does that colposcopy, what does that do, what is significance for that? So just wrapping up, the exfoliated cervical cells serve as a tool, strong tool to indicate whether there's some atypical cells undergoing malignant change. So that's the mechanism for the Pap smear. And since the human papilloma virus has the increased risk of the cervical cancer, so that's why the vaccine developed start from teenager to receive 2 doses of this vaccine. And then the colposcopy is based on the Pap smear results, see how the atypical cells undergoing the malignancy change, or how deviated from normal cell type, and or probably couple Pap smear later still showed abnormal cells. If that's the case, then your physician will do the colposcopy to examine, and then usually along with the colposcopy do a small piece of biopsy. So for example, if the Pap smear showed abnormal cells, then you look at on the colposcope, you see at around like a clockwise at the 3 o'clock, 9 o'clock, you see some abnormal change. Then you do this kind of tissue and biopsy and send to the pathology, just to make sure either to diagnose or to exclude the cervical pre-cancer or cancer change. So this is a very superficial, just explain what is the cervical cancer and what is the preventive measures and the significance for women's health to do the HPV vaccine, to do the Pap smear every 3 years, and to do the colposcopy if your physician recommended to do it, and you just follow the advice to do it, which is to identify the cancer at early stage, to treat early, to guide the treatment plan. So this is the video for cervical cancer prevention and colposcopy. I hope the take-home message is do the annual physical and follow your physician's advice and get the HPV vaccination at the appropriate age. So thank you for watching. I will see you next time.